Kristina Towill has a practice that's built on intervening and helping people discover the conversation and how to find intimacy. A little late arriving here tonight, but the reason was a good one, a birthday party, her daughter's. And so would you please welcome Kristina Towill. Great to see you.
Thank you. I'm actually, with that introduction, I'm thinking you should be doing what I do for a living. That was lovely. So indeed, we're going to talk to end the evening about, I think in some ways, the context in which sexual dysfunction and of course men's health problems in general occur. I look around the auditorium this evening and I see that many of you are here with a significant other. And in my practice, I have the good fortune of working with, actually a majority of my patient load are couples from 45 to 65 years of age. And about 50% of what I do is sexual and reproductive health, and about 50% is general psychology, so mood disorders and adjustment issues and the like. So let's get started. So the first message, and I'm sure you've been getting this over the course of the evening, is that sexuality is really a lifelong experience. And unfortunately, certainly in North American culture, there are very narrow definitions, I think, of how we perceive beauty, sensuality, sexuality. And that's, we do a great disservice, not only to ourselves as we age and not seeing ourselves as sensual, sexual, beautiful beings, but I think at many levels as a mom of young children, we do a disservice to the upcoming generations and not giving them a broader perspective of what it means to be a sexual being. And we are from birth to the time we leave Earth, and it's something that for many couples in their middle years and certainly into their golden years becomes and stays a very relevant issue. Also, good news, and some of you may have a sly smile as I go over this statistic, there's a lot of research showing that in fact couples in their midlife, 40s to 60, actually enjoy the greatest level of sexual satisfaction of any group. You probably have a sense of why that is. The first thing is, hopefully, by sometime around 50, 60, we're starting to get it right in our relationships, right? We're starting to figure it out. And you know, maybe by the time you're 80, you kind of get it. Hopefully, along with that, we're starting to learn how to talk. Phil had mentioned that, you know, we talk differently, men and women. It's a fascinating study by one of my favorite authors, John Gottman, who's a prolific writer in the area of marital therapy. And he found that he asked couples to come into his lab, he calls it his love lab, out of the University of Washington, and he asked them to talk about something that had been a contentious issue in their marriage in the last, month or two. And so they would revisit an issue, right? Who's going to mow the lawn? Who took out the garbage? You know, you make too much noise when you're snoring. And what he found was that, and by the way, these couples were hooked up to physiological measures of arousal, so sweating, heart palpitations, all that kind of stuff that shows kind of how stressed we are physically. Anyone have a guess what happened as the couples talked? What happened to the men? Did they feel better, calmer, more comforted by chit-chat, or did they feel worse? Look at all the men going, ugh, right, as they relive the recent conversation. Yeah, they felt worse. And he terms this flooding. And the women, in the meantime, were just tickety-boo. They were feeling better and better as they talked more and more around, upside down, inside out, about the issue. So we're built, in other words, very differently, biologically, biochemically. And I think many couples in their midlife start to kind of figure this out, right? And he's maybe willing to talk a bit more. And as my mother used to say, you know, good marriages, Kristina, are built on what isn't said as much as what is. So maybe we ladies learn how to zip it. Also, when we talk about context, how we sort of love make in real life, couples in midlife have a lot of respite from some of the issues in younger years that may serve to pull us away from each other. Child rearing, 4-year-old birthday parties, financial issues, often career pressures as we build our professional lives. And that too can in some ways just give more room in a relationship for time and focus on sensuality. Also, back to how we started today about feeling good about our bodies and ourselves, regardless of what the magazines and TV show us, the research would suggest that couples in midlife are more comfortable with their own and with their spouse's bodies. And that's a good thing, right? A little bit of cellulite didn't hurt anybody. We're not supposed to look like we're 17. And finally, a lot of the couples that I work with, I often say just get it. They get that good sex is not about performance. It's not about how long or hard or et cetera, et cetera. It's really about enjoyment. And certainly many of the conditions that Dr. Carter was alluding to, couples have to adapt in profound ways. Prostate cancer patients that I work with after they've recovered from their surgery. There are profound accommodations and adaptations that these couples have to make. And couples with a good, strong base go ahead and they make those adaptations and they connect in other ways, in ways that are still sexual, but that are not intercourse-based and do not require the rigidity of erections that perhaps they once enjoyed. Since we've been talking about men all night, I thought we'd say a little bit about women as well. So I talk about sort of menopausal myths. There's a lot of myths out there about when women hit middle age and hit menopause. Certainly, again, back to those cultural beliefs, there is a kind of writing off often of women in midlife as retired sexually, that they're undesirable. And that's simply not the case. As I said, couples actually enjoy happier and more satisfying intimacy at this stage of life than any other. Also, some interesting research on particular demographics. 80 to 100-year-olds, a quarter of these couples actually do have, or women have, a regular intimate partner. Now, I say intimate because that doesn't mean that they are actually having intercourse the 3 times a week or whatever the statistic is for the nation's average. It's actually not that. That statistic came out of a rather unsavory magazine years ago. The Canadian statistic, I think, Stacey, what is it, 2 to 6 times a month for couples under 60 for intercourse? You never go there. You see, this is a smart lady. She doesn't even go there, right? What's normal? And that 75% of women over 65 have a regular intimate partner. Roughly 1/3 of women that are menopausal, postmenopausal, do complain of vaginal dryness, less, more, depending on the study that you look at, though they tend to, again, accommodate and adapt and continue to enjoy sexual relations with their partners. ED is a very common cause of sexual inactivity in women midlife. And also, of course, many women outlive their male partners and may live without a partner, without a sexual partner, without a companion for a decade or more. And so there are unique issues for those women in maintaining a sense of their own sensuality and sexuality. So I wanted to just talk about sort of what do we know about the predictors of sexual satisfaction in midlife. And if you go away from my little bit with nothing else, what I want you to remember is that the number one predictor for couples in terms of their sexual satisfaction, their overall enjoyment of their lovemaking in midlife is the quality of their intimate relationship prior to midlife. Common sense, right? So it means that this is really a lifelong endeavor that we all have to nurture and work at and preserve and keep strong and healthy. And I'm very, very privileged to work with couples who, in a very direct way, show up in my office and say, hey, let's do something about this. And I consider it to be a great honor. Marital status, as I said, if you don't have a partner, divorced, single, widowed, obviously there is going to be a harder time maintaining sexual health in midlife. Mental health, I don't know if we've touched, since I unfortunately missed Dr. Goldenberg's presentation, but certainly the mood disorder spectrum, depression and anxiety in particular, are strongly comorbid with sexual dysfunction. In fact, for depression, we actually use sexual dysfunction as a criteria for diagnosing that particular disorder clinically. Physical health. I know that, and I've heard Stacey talk so many times over the years, and one of her main messages always is, if your body's healthy and if you're fit and physically healthy, sex is going to be that much easier.